Thank you. Any questions for Deputy? Seeing none, thank you. Jeffrey Dale, are you here? Good morning. Okay, you have 5 minutes.
Thank you for allowing me to speak today, and good morning, Chair Moyes, members of council, city staff, and members of the public. I'm Reverend Jeffrey Dale, and I'm the minister at College Street United Church at the corner of College and Bathurst. I live near the church, and as such, my home and church are situated between two safe consumption sites, consumption and treatment services, Parkdale Queen West and Kensington Market, both slated to close. Since the province's announcement in August 2024, College Street United Church's electric sign has proclaimed that harm reduction is spiritual. Save SCS. As a community of faith, we are training ourselves in naloxone use and have naloxone kits in every bathroom and office in our building. I come to you today as a minister, but also as a former user of illicit substances, to appeal for your support to uphold the potentiality of your Our Health, Our City substance use strategy. Just over 10 years ago, I was addicted to Oxycontin. In many ways, I was fortunate. I bought my pills on the street, and at those pills were real Oxycontin. I lived in a relative comfort. That is not the same for others today. Since then, I have watched this country, province, and city's realities relating to substance use change and evolve, and not for the better. Each of us in this room know the realities and statistics of how harm reduction saves lives. We know that safe consumption sites and services save lives, and yet here we are, again, asking that our friends, our neighbors, and our community be afforded the opportunity to live. We at College Street are extremely fortunate to host the winter meetings of the Harm Reduction Advocacy Collective. This advocacy collective comes together to proclaim one another's worth and dignity, protect one another's agency for an opportunity for life. Since coming to College Street in May, I've experienced people in need, and most often these people engage in substance use. It exhausts me that our fights in the past, which brought us further to building a community of care, are unraveling right before our very eyes. It aggravates me that we must continue to protest and call upon our levels of the government to assist us in seeking ways to reduce harm. Most of all, though, as a citizen of the city which I so dearly love, I am grieving that the most marginalized citizens are being pushed further into the corners and the shadows. Our neighbors are crying out in pain. And so often I wonder, will we ever hear their laments in the din of a city progressing along? We need you more than we ever have before, to join us beyond the walls of City Hall and out into the trenches of this war that has been waged against people who need harm reduction. The province's decrees, once again, have called many of us to action, and in doing so, it brings up our pain and our fear. And so I implore you to ensure that harm reduction and consumption and treatment services are not wiped away with the provincial announcement and pending legislation in our neighborhood and throughout this city. This is truly our opportunity to envision a Toronto the good that is good for all her citizens, especially those who will and are dying in the shadow of the CN Tower, hoping against hope that someone, anyone, is listening. At the end of every harm reduction advocacy collective meeting, we join together in a circle and vocalize the names of those we've lost due to toxic drugs. Every time, names flood out. And I recognize just how large our circle would be if we were all afforded the same dignity and privilege others are gifted with by those in power. Our leaders will then say, "We mourn the dead and we fight like hell for the living." Now is the time for us all to fight. I can only hope that you will all be with us on the front lines once more. Thank you for your time.
Thank you, Jeffrey. Any questions for the Deputant? Seeing none, thank you for coming in today. Kevin Wilson.